A professional counselor in the Dallas area is growing in popularity for his treatment methods.
How do you talk to kids about terror? And with social media and television, it's everywhere, and it's unavoidable for kids.
Rusty Lozano is the founder of the Center for Biofeedback and Behavior Therapy. He's also been nationally recognized for his work with brain mapping.
He's created a gym to work out the mind. His office features an obstacle course.
Rusty Lozano is a licensed professional counselor, helping children with headaches, with anxiety, ADHD, and more.
Here's where Lozano comes in. He teaches kids how to think their pain away with something called biofeedback.
A North Texas therapist is treating patients in this unconventional way.
We have Rusty Lozano who's joining us today. He's a licensed professional counselor.
He put together an unusual treatment for teenagers who are struggling with mental issues, except he's taking this now a step further.
Rusty Lozano, a leading therapist and pediatric biofeedback therapist based in Texas at the Center for Biofeedback and Behavior Therapy. And Rusty, thanks for being with us tonight.
Rusty Lozano, a father of 4 and also a professional counselor in Texas, says it's all about being a credible resource to your children.
The Therapy Hour with Rusty Lozano, your dedicated resource for mental health news, views, and tips you can use. Brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas. And now, here's Rusty.
Hi, good afternoon, and welcome to the Therapy Hour with Rusty Lozano. It's a great, beautiful day outside. We have an interesting guest today. Absolutely excellent resource for the community. Stephen Herzog, he's the medical director of the Headache Institute at Texas Neurology and clinical professor in neurology at Baylor, Texas A&M. He's going to talk to us today about migraine headaches. But before we get started, I want to kind of read you a little bit of the statistics about headaches in the U.S. And this is actually, it's quite telling. In the U.S., more than 37 million people suffer from migraine headaches. Some migraine studies estimate that 13% of adults in the U.S. population have migraines, and 2 to 3 million migraine sufferers are chronic. Almost 5 million in the U.S. experience at least one migraine attack per month, while more than 11 million people blame migraines for causing moderate to severe disabilities. About migraine sufferers, here are the statistics on the migraines occurring most often in women. 18% of women compared to 6% of men, and also people between the ages of 35 and 55. That's that's amazing, immensely important to know, mainly because it's what do you do? I mean, where are these? Who do you go and speak to, and what's a good, reliable resource? Let's talk about the segments today and what we're going to discuss. We're going to define what a headache is in the segment 1, what the difference between the most common types are. In the second segment, we're going to talk about evaluation and management of migraine. In the third segment, we're going to talk about treatment options. And then in the fourth segment, let's talk to the doc. We're going to call in. We're going to open up the phone lines, 214-787-1190 or 817-787-1190. And we're going to talk a little bit about, ask questions to Dr. Herzog and find out where he is. So without further ado, I'd like to welcome Dr. Herzog to the show. Thank you for being on.
Thank you. I appreciate it.
Well, Dr. Herzog, so these statistics, I'm sure you are very familiar with them and the populations of individuals that come in. Let's talk about what is a headache. Can you define a headache for us?
Well, a headache can be anything from an awareness or discomfort in the head to severe pain. But headache is a generic term. It really doesn't define why you're having a headache or the cause of the headache. So we use the term headache loosely when we're trying to evaluate a patient and they come in and they're complaining of discomfort.
It just kind of gives you a general idea of what type of pain they're experiencing, and then you start looking into more specifics. Okay, what are the background concepts?
The three main types of headaches that most people are familiar with are going to be tension headaches, which is really the most common headache disorder of the general population. Probably 95% of people have had a tension headache in their lifetime. These are relatively mild headaches. They're not generally headaches that people go to see their physician for. They are not generally worsened with activity. They don't tend to be severe, and they're often not accompanied with any unusual symptoms, and respond to over-the-counter medication and natural treatments.
So you'd see tension headaches being like kind of around the frontal, forehead, temple, back of the neck, kind of those areas?
Exactly, often described as a hat band. Pain goes all the way around the head as opposed to being one side or the other, front or back. It's kind of a diffuse pain in the head.
I see. And that's actually, does that still fall under the category or the classification of migraine?
No, tension headaches are a separate disorder altogether. Migraine is a disease in and of itself, and migraine is a chemical neurotransmitter problem in the brain, and the brain is hyperexcitable. And so when somebody has migraine, they have a disease of the brain, kind of like someone would have asthma. They'd say, I have asthma, and because I have asthma, I have trouble breathing, and when I have a severe problem, I call it an asthma attack. So a migraineur, a person with migraine, might say, I have migraine, the disorder, and I have pain in my head, and sometimes it's mild, moderate, or severe, and I call it a migraine attack.
I see. And so it can classify as a disease, essentially.
Absolutely, absolutely. And it's an inherited family disorder.
Is that something that like people maybe they may not actually experience any of the symptoms early on in their life, and they may maybe have a later onset, or if you're a migraine sufferer, you're going to have it, and essentially it's always going to be there?
Well, you have the genetic predisposition. As a family disorder, a person may not manifest the disorder until their teenage years or later. Even people can manifest the disorder very late in life, brought on by an injury or an illness. So you have the genetic predisposition. That doesn't mean you're going to necessarily have the symptoms of a headache.
I see. What are the other types of headaches that you typically see?
Well, there are hundreds of different types of headaches and subtypes of headaches. Migraine's probably the most common disorder that I see in the office, with chronic migraine being the most common subtype I see. Chronic migraineurs are people who have greater than 15 headache days per month with migraine features. One of the most common disorders that people report is a sinus headache to their physicians, and actually 80% of sinus headaches are actually migraine. They're not sinus headaches.
Interesting. So even though it may actually kind of manifest through like this sinus area, it actually is still classified as a migraine?
Absolutely. For a true sinus headache, you have significant nasal discharge, low-grade fever, and it's really an infection in the sinus region. But the nerves that are in the sinus region are the same nerves that are involved in migraine, coming from a migraine generating center in the brain called the trigeminal complex. And those nerves can be activated at pretty much any part of the head.
I see. And, the aura effect, some individuals actually identify seeing flashing lights, or they may see kind of like a white scale of like veins in their eyes. Is that a common characteristic of migraine?
Actually, it's not. And that's misunderstood by a lot of people and a lot of medical professionals as well. Aura is only occurring in migraine patients approximately 20% of the time. So the majority of patients with migraine have never had an aura.
Interesting. So that's not necessarily, if you have a headache and you're not having auras, then you can't really correlate those or say that, okay, I'm not having auras, so this isn't a migraine.
Exactly. A lot of people misdiagnose themselves or are misdiagnosed because they didn't have an aura, or they had a concept of what a migraine might be, and their mother or their sister had a migraine, and so they come in and say, well, I'm just having a regular headache. To a headache doctor, there's no such thing as a regular headache. It's got to be due to something.
It's always due to something. And, those are actually categorized as stress-related disorders. You see, in my field, in biofeedback, we look at the stress component in the body, and we help them use relaxation strategies to help calm themselves down. So the concept then is that there's a lot of vasoconstriction around these little vesicles around the cranium, and they're essentially like they're either kind of pinched off because of corticotropins or muscle tension in the body. Do you see that? Would you agree with a theory like that?
Well, that's a component of migraine. Migraine used to be called the vascular headache syndrome. We learned a lot about migraine in the last 25 years, and we now know that it's a neurotransmitter disorder that leads to inflammation in and around the blood vessel, and the brain is hyperexcitable in a migraine patient. So the actual cause of the headache disorder is different than the trigger for the headache. And there's a difficult concept often because people want to know, well, what's the cause of my headaches? And I have to train a patient to understand that the cause of the headache is the genetic predisposition, the chemical neurotransmitter difference in their brain. The trigger for an individual headache attack is variable. It can be stress, it could be weather, it could be certain foods, it could be illness, it could be injury. So the triggers are variable, and they can be variable from one patient to the next, and they can be variable within one patient from one day to the next.
You know, and you mentioned something really interesting about weather. So a lot of people who are migraine sufferers have barometric pressure sensitivities. How does that affect people with migraine headaches?
We don't know.
Yeah.
It's a very interesting question, but there's no question that people are affected by weather. Patients often will say, I know when a storm is coming a day before it's coming, or if the barometric pressure rapidly changes, or if they go to a different altitude with different weather, it can provoke a headache. So it's the patient's sensitivity for a particular trigger that can bring on a headache. And the threshold and the triggerability are playing against each other. So a patient with a very high threshold and a very low triggerability may almost never have a headache except under the right circumstances, which could be one or multiple triggers at a time. A patient with a very low threshold and a very high triggerability could have a headache all the time, and they have difficulty determining what their actual triggers are.
And so there comes the reason to come in and actually seek out specialization treatment for discovering what can be done. If you're just visiting us, we are visiting with Stephen Herzog, the medical director of the Headache Institute. We're going to take a commercial break. We'll be right back after these messages.
From the Talk Radio 1190 Weather Center, this update is brought to you by Wix. Sunny today with a high in the upper 70s, clear tonight with the low around 56.
If only everything in business was as easy as creating your own free professional website with Wix.com. No tech skills are needed, and you can choose from hundreds of beautifully designed templates. It's easy. Get your business online today for free at Wix.com. That's Wix.com.
Hi, I'm Brendan Burchard. Some people call me the world's highest paid motivational trainer, and some people call me crazy because I've just authorized a nationwide giveaway of my recent New York Times bestseller, The Motivation Manifesto. In the next 24 hours, I want to give away as many free books as possible. To get your hardcover copy, text book 10 to 99,000 or go to motivationbook.com. If you want to reach your true potential, personally, professionally, or financially, you need this book. You'll discover how to stop feeling tired and overwhelmed, identify the major enemies keeping you from living your dreams, and learn the secrets to defeating them. I'll teach you my proven strategies to start attaining the levels of drive and personal success you're craving. Financial freedom, emotional freedom, time freedom. Due to high demand, I can only offer one free book per household. To get your free book while supplies last, text book 10 to 99,000. That's BOOK, the number 10, to 99000, or go to motivationbook.com.
Message and data rates may apply.
Guys, are you tired of being tired? Frustrated because it seems impossible to lose belly fat? If you're looking for a solution, then listen to Mark.
I had fantastic results with the Andro 400 Max. Probably lost 35 pounds, and more impressive than that was the inches I lost off of my belly and my waist. And the increased energy is fantastic. I'll be totally honest, I tried a different product, and I wasn't happy with the different product. You guys are considerably cheaper than the other brand, and I can really feel the difference.
Andro 400 Max, the extra strength, all natural testosterone booster. The safe, easy, and affordable way to gain energy and lose stubborn belly fat. Satisfaction guaranteed or your money back. Feel and look like a new man. Go to andro400.com or call 888-400-0435. 888-400-0435.
With so many people thinking about the future in the beginning of a new year, I can't not take a moment to tell you about a great place like this that helps you forge a new path that has a brighter career future ahead of it. It's nothing magical. It's nothing difficult to believe. It's a campus. It's a training center right here in the Irving area, and it specializes in redirecting people's career path. We're talking about the IT industry. Maybe you've heard about my computer career and thought about getting into IT. Maybe you've thought about a career in computers. Maybe you've spent 5 minutes on your smartphone to take their 5-minute career evaluation at mycomputercareer.edu, but you haven't visited the school or seen the classrooms. Maybe you haven't met the IT pros who can help change your life. At their campus, in a matter of months, you learn the skills you need to get an IT job. To get the job, You've got to get the skills, you've got to get the certifications the employers are looking for. There's financial aid available for those who qualify, including the GI Bill. How about a career change? It could start with a free career evaluation. 5 minutes of your time at mycomputercareer.edu. A new year can mean a new career. mycomputercareer.edu.
You're listening to the Therapy Hour with Rusty Lozano, brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas.
Hi, we are back, and if you're just joining us, we have Stephen Herzog, Medical Director of the Headache Institute at Texas Neurology and Clinical Professor in Neurology at Baylor, Texas A&M. We're discussing migraine headaches. And over the break, actually, we queued up a pretty interesting conversation about some of the different ways, and we're going to start segment 2 here in a bit, but I just wanted to chime this in. But some of the interesting ways that the migraine headaches can actually manifest that aren't necessarily migraine-esque, but they can actually seem different symptoms.
Migraine can be a very complex disorder. We define the migraine attack as beginning with a prodrome, possibly an aura, and as we said, 20% of the patients might have an aura, the headache phase, and the postdrome. And that whole attack can be from 4 to 72 hours. Patients can have a prodrome, which is just an awareness that they might be getting a headache that day. The aura is usually a visual symptom, although there can be all kinds of different auras. The headache phase can last hours or days, and then feeling pretty rotten after the headache has resolved. But you don't have to have a headache to have a migraine attack. Some patients only have an aura, and they never have a headache, or they don't have a headache every time they have an aura. Some people might just feel light or sound sensitive and be a little queasy without much of a headache at all. And this is where the diagnosis can get tricky.
Mm-hmm. Because it's not actually manifesting as true headache pain, but it's actually a some other effect, some other side effect like dizziness, or you were even saying like sensitivity to light and sounds.
Absolutely. Those symptoms aren't because a person has a headache. Those symptoms that you might get with a migraine attack are because of neurotransmitter dysfunction in various parts of the brain, which is why you can have dizziness, lightheadedness, light sensitivity, sound sensitivity, and you may not have a headache.
That's phenomenal. That's really interesting information there. I think because the elusiveness of the migraine headache condition is that we're always looking for pain, and our benchmark to determine how's your migraine is determined on do we feel headache? I mean, do we have a headache or not? But not looking or paying attention much to the other side of the other symptoms. It could be essentially the presence of that migraine.
Absolutely.
Let's move on to our second segment, which is evaluation and management of migraine. So when a patient contacts your office and they come in and they sit down with you and they start describing their symptoms, what's the process for evaluation? I mean, how do you start to categorize this and discover what's going on?
Well, the most important thing with any medical issue is always the history, taking a good history and identifying what the patient has experienced before, what they're experiencing now, what their family has experienced, and taking into account all of that and putting it together almost like a puzzle to come up with a diagnosis and then try to confirm that the diagnosis is or isn't migraine.
And do you is this done through an interview? Are there any type of evaluations that maybe test pressure in the vesicles or blood pressure? Is that valid? I mean, you guys use something like that?
Well, after the examination, a full neurological examination, after the history, a full neurological examination needs to be done to rule out any secondary causes of headache. Secondary causes of headache are the things that patients are often worried about, brain tumors or stroke or infection or inflammation. In an outpatient setting, they're exceedingly rare. Probably less than 1% of patients have a secondary cause of headache. But that's the most important thing we do as a physician, is to try to determine if there is a secondary cause, and then if there isn't, to confirm the diagnosis whether or not it might be migraine.
And are you, and when you think about the statistics of individuals who come from predisposition, is it pretty? Are the percentages pretty high that these individuals there is a familial hereditary pattern?
Well, I like to quote to patients that 95% of patients have a family history of migraine, and the other 5% just don't know their family history yet. Yeah. Often by the time they come in the second or the third visit, they say, oh yeah, now I know, I remember so-and-so has headaches. And of course, our main objective at the first visit after the evaluation and coming up with a management program is educating the patient to understand their disorder. And that can take multiple visits before we're on the same page.
So when you educate the patient, then a lot of times they're really not really familiar with migraines and how they're manifesting. And so now they've learned something new, maybe keep away from certain things like caffeine, certain spices. Is that something that you guys recommend?
Our first line of treatment is always to go from a natural perspective. We want the patient to be exercising regularly. We want them to have a proper diet. We want them to be drinking plenty of water, getting good sleep and good rest, reducing stress in any way they might be able to reduce their stress, and then looking at their triggering factors and seeing if they can identify triggering factors by monitoring a headache calendar, and then trying to reduce the triggering factors that are manipulatable. Now, some things aren't. We have our stress in our lives. We have kids. We have family. We have work. And sometimes things like that can be significant in terms of a trigger. But the triggering factors that can be manipulated need to be manipulated.
Yeah, and so and that would actually make the management portion of really getting to this symptom management really difficult, because you're talking about healthier lifestyles, like maybe changing some of the things that you've done in the past, incorporating exercise, and all these are really beneficial. Do you see a big proponent of people into actually following or integrating this, or are people still kind of slacking off on it?
Well, I think as with everything, everyone would like a quick fix, and it sometimes takes multiple visits before we convince a patient that they have to be involved in their medical care, and that without the foundation of a natural approach to treatment of headache disorders, we're not going to get anywhere with medicines. You're really going to be wasting your time just taking medication.
Yeah. Do you see obesity as a big part of a big contributing factor to that, or is it just...
Well, there have been some links between obesity and transformation from episodic migraine to chronic migraine. It probably relates to the overall poor lifestyle choices and related to diet and hydration and exercise, proper sleep and rest that also go along with obesity. So I think obesity can be a major factor in deterioration in terms of one's headache history.
Yeah. Yeah, we had an individual, a doctor here that was talking about obesity, and it was really interesting. He was a pediatrician, and he was talking about how, the more obese an individual is, their body starts to age much quicker than the average individual. So there's a lot more strain. You're going to start to see a lot more of these symptoms coming on earlier in your life than you would if you're like much later, in a later stage in your life. Do you see? Would you agree with something like that?
I'd agree with that. In patients, I try not to emphasize dress size and waist size and actual pounds. I try to emphasize fitness. I think if people focus on fitness first, they often with time will just naturally lose weight. So we focus on fitness and how to get more active and what kind of exercises are appropriate for them.
Just like just management. I mean, you're really just staying fit, heart management, making sure that your system is healthy and blood pressure is great, and maybe integrating some more healthy choices as far as keeping hydrated. Hydration is a huge component of being able to stay fit and healthy. Is that a triggering mechanism for migraines?
It is, and we find often that people don't realize how dehydrated they are. Often by the time you're thirsty, you're already dehydrated. So keeping hydrated, especially if you have a headache disorder, is critically important. Drinking, water, limiting caffeine, limiting tea and coffee. A headache patient can often improve their headache threshold and decrease their triggerability with hydration.
So let's go back to that whole limiting caffeine. What is the effect of caffeine on headache sufferers?
Well, caffeine is a double-edged sword, as things often are in medicine. Caffeine is often included in a number of medications to improve the analgesic effect, say, of acetaminophen or aspirin or other prescription medications. But if taken too often and in high quantities, caffeine actually can work in reverse, as any medication can, to lead to what we call rebound headaches. And that can be a vicious cycle where you become dependent on the caffeine to feel better. As the caffeine wears off, the headache develops, and then you drink more caffeine or ingest more caffeine, and all of a sudden, you can't get out of the cycle.
That's interesting. So you would have to actually, you become dependent on it.
Absolutely.
I think my wife actually had that. She would drink Dr. Pepper. She'd have one every morning. She's not doing it anymore. We actually are integrating more healthy choices, but she would have to have her caffeine in the morning, and then when she actually started to wean away from Dr. Pepper's, she would have just terrible migraines, and she's consistently taking acetaminophen.
Yeah, absolutely. People, it takes about 6 to 8 weeks of withdrawal, as it does with any habit, good habit or bad habit, to unwind from the habit. So people need to be committed with their diet and with all of these issues regarding a natural foundation to their headache treatment.
So you can expect some sort of a rebound effect, 6 to 8 weeks, just if you're almost like a detox, if you will, getting off of things like excessive caffeine. And what about like taking over-the-counter pills? I mean, is that a trigger?
It can be a trigger. Aspirin, acetaminophen, all of the analgesics that you can buy over the counter potentially can lead to rebound if taken too often. The acute treatment of a headache attack needs to be combined with the preventative treatment of the headache disorder. And if you're focusing on just treating the attacks, you're going to quickly get into an overuse situation.
I see. And you see that a lot in your office?
That's actually the most common thing I see is chronic migraine with people that have greater than 15 headachy days per month.
Interesting. That's fascinating. That's incredible statistics. And so that would require, people are trying to get self-help. They're trying to find these ideas to help them feel better. And a lot of times it sounds like they're actually just making it a lot worse.
Often they are.
And that's where you guys come in. If you're just joining us, we're visiting with Stephen Herzog, Medical Director of the Headache Institute at Texas Neurology. We'll be right back after these messages.
From the Talk Radio 1190 Weather Center, this update is brought to you by Wix. Sunny today with a high in the upper 70s, clear tonight, the low around 56.
If only everything in business was as easy as creating your own free professional website with Wix.com. No tech skills are needed, and you can choose from hundreds of beautifully designed templates. It's easy. Get your business online today for free at Wix.com. That's Wix.com.
Hi, everyone. It's Rodney Anderson with Supreme Lending. 2016 is going to be a big year for real estate again. In fact, I look for home values definitely to go up 5 to 6%, and I look for refinance activity to stay very strong. Now, the first thing you need to do if you're going out looking for a house, get pre-approved up front. We can do that today, have you out shopping right away, and we're closing our purchases in 15 days or less. If you're in the market to buy a home, give us a call right now. 1-800-EXPRESS is my number. Now, the refinancers. So many people call in our office. Number one reason, cash out refinances to pay off credit card debt. Home values have gone up so much that a lot of people have equity in their home. They're taking that money out to pay off debt. Also, people are calling to lower their interest rate, lower their term. If you're in the market to buy or refinance, 1-800-EXPRESS, or you can always apply online at rodneyanderson.com.
Supreme Lending is an equal housing lender. NMLS number 196730, 4975 Preston Park Boulevard, Suite 800, Plano, Texas.
Blood, sweat, tears, guts, tenacity, and grit. That's what it takes to be a small business owner today. It's what gets you through the endless hours, missed calls, and countless resumes. That's where Monster can help. We design custom hiring solutions specifically suited to your small business to find rock-solid candidates. Because at Monster, we've got our own fair share of fortitude and fearlessness. Visit monster.com/hiring for a limited time offer and find employees who work as hard as you. Monster, find better.
Do you have to worry about identity theft during tax season? Yes. The IRS has reported over $6 billion in fraudulent refunds in a single tax year due to identity theft. Does it matter if you're not getting a refund? No. Thieves can use the information from your tax documents to steal your identity anytime. Can getting a neck massage make worrying about identity theft less stressful? Yeah, who doesn't like a neck massage? But it won't help like LifeLock can. When you're a LifeLock member, you have access to our team of US-based specialists who know the steps to take to work to resolve identity theft issues during tax season and every other time of year. With LifeLock, identity theft can be less of a pain in the neck. Get LifeLock for peace of mind year-round. Memberships start at $9.99 a month plus applicable taxes. And now you can get 10% off. Go to LifeLock.com and enter promo code NEWS. LifeLock.
You're listening to the Therapy Hour with Rusty Lozano. Brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas.
Hi, and we are back. Thank you for joining us. We are visiting with Dr. Stephen Herzog, the Medical Director of the Headache Institute at Texas Neurology. He's a clinical professor in neurology at Baylor, Texas A&M, and we're discussing migraine headaches. Our next segment, we're going to be discussing treatment options, and then in our fourth segment, we're going to be talking to the doc. So we're going to open up the phone lines at 214-787-1190 or 817-787-1190. Dr. Herzog, let's talk about treatment options at Texas Neurology, and give us some idea of what treatment options look like. What recommendations do you have?
Well, our approach, as we talked about in the last segment, is to begin with the natural approach and educate the patient about ways of improving their headache threshold and decreasing their triggerability so that they'll hopefully have less headache. The most common patient I see is the chronic migraine patient with greater than 15 headache days per month, and often they have a headache every day by the time they come in to see us. So these are people that are severely impacted by their headaches on a daily or near daily basis. So once we get the foundation set of the natural approach, adjusting their diet, improving their sleep and their rest, getting them to do some sort of stress-reducing technique, hydration, vitamins and minerals if appropriate, biofeedback, acupuncture, whatever might be the best thing for that particular patient, then we need to start talking about whether or not medications are appropriate. We don't want to overemphasize medications. We want the foundation to be a natural approach, but sometimes medications are necessary.
And if in medications, in those cases when medications are necessary, is this like a long stay of meds?
As with any medical disorder, some people begin medication and then require them for an indefinite amount of time.
Sure.
But if they're willing to become part of their medical progress and improve their overall well-being, often they can come off their medications in the future.
So because you offer a lot of these natural approaches, lifestyle changes, recommendations, you're even talking about book recommendations that you have given patients. And so really treatment and the success of the treatment is going to be determined on themselves.
Absolutely.
So you're there to help. I mean, you're there to give them treatment advice and treatment options with medication, and also to try to get them in the right path, because it's real easy to kind of step into a snare of diet decisions and hydration decisions. Drinking tea and coffee and Cokes isn't necessarily hydration. You need something a little bit more pure.
Well, absolutely. Actually, tea and coffee often are dehydrating. So if you're drinking coffee in the morning, you need to be also chasing that with some water.
Interesting. I guess I need to start incorporating my glass of water with my wake me up in the mornings, because that's something that I never really considered. But you're right, it is a diuretic. And so this is something that you need to kind of balance that with everything else. What are some other treatment options? You discussed sometimes stress-related disorders can call for other interventions, counseling.
Counseling, biofeedback, yoga, Tai Chi, exercise, of course. All of that is to help reduce your stress and improve your headache threshold. So it's very important that people are active if they have a headache disorder, and often you don't want to be active when you have a headache disorder, so it becomes a catch-22. But we have to encourage them to become more active.
And it doesn't necessarily mean that you have to go full in on like a yoga approach or aerobics, but maybe even just taking a walk.
We start with patients walking. That's the most important thing.
Like maybe parking a little further away, so you have to walk further to your car. Something simple like
or
that.
Taking the stairs.
Taking the stairs instead of the elevator, yes. That would actually be very practical. If you're just joining us, Stephen Herzog is with us. He's the medical director of the Headache Institute at Texas Neurology. Now, how long have you been in Dallas? Where's your center at?
Our center is in Lakewood on Gaston Avenue, and we've been in practice now 30 years. And trained at University of Texas Southwestern here in Dallas, and I've been here ever since my training.
Fantastic. And so you see a lot of population. You work primarily with a lot of adults.
I am an adult neurologist.
Adult neurologist. So with adult neurologists, do you actually see that more adults are more hesitant to come in for treatment and they would try to muscle through it? Or what's the attitude that you...
Often, by the time a patient gets into a headache center, they've seen their physician and maybe even other neurologists, and they haven't necessarily done well, or they wouldn't be coming to see us. it's usually an education problem, a misunderstanding of their disorder, misunderstanding of the concept of threshold and triggerability, as we've talked about, and a misconception about what the medications can and can't do.
There's an over-reliance in saying, well, this medication should work, and it's not, and so we're either going up or down or integrating other medications. That's not really a time to quit, but that's really a time to kind of start looking at these other recommendations that doctors actually have.
Absolutely, absolutely.
And, one of the things that I think is really fascinating about the treatments of migraine headaches is that because there's such an array of different symptoms, the symptomology, it does take a lot of education. I think that it's almost your responsibility to go and do research yourself to find out, okay, what are these other symptoms I'm experiencing? Document them so you can share them with your physician, and so that they have a better idea of okay, keeping track of what's working and what's not working.
We always appreciate when a patient comes in with a calendar, documenting their headaches, what they may have been eating, what they may have been doing. It assists us in working with the foundation again of a natural approach, and then taking into account their overall medical history. We then determine whether or not a particular medication might be helpful.
Interesting. My own curiosity is, what about sleep deprivation, and what about sleep cycles? Do you see that being a triggering effect of migraines?
Sleep is a trigger, and we encourage proper sleep and rest, sometimes to the point where a sleep study may be indicated. If a patient has a lot of snoring and poor sleep and early morning headache, it's very possible they suffer with a disorder called sleep apnea. But insomnia in and of itself can be a trigger, and often that becomes a vicious cycle as well, because taking a nap in the afternoon, not sleeping well the next night, taking medication to sleep, those medications themselves for sleep can actually be provocative in terms of the headache disorder.
What does that do if your sleep cycle is off? What's going on in the body? What's essentially happening that's actually creating the migraine?
Well, you're without adequate sleep and rest, you're not recuperating, and without the recuperative effects of sleep, your threshold is lower, making you more prone to a headache given other triggering factors. So whereas you might not have been as prone the next day had you slept well, had you not slept well, and other factors are involved, say a poor diet, or you didn't hydrate well, or it was a particularly bad day in terms of stress. Whereas had you slept well the night before, you may have been, with a higher threshold, not developed a headache.
Yeah. Does blood pressure have anything to do with that?
Blood pressure can trigger headache if blood pressure is out of control, and we always monitor blood pressure at every visit to make sure that the patient's blood pressure is in the normal range.
Yeah. Because I'm curious about, how if somebody is sleep deprived, what's going on with their blood pressure is essentially their energy is based on synthetic neurochemicals to keep them going.
Absolutely. If they're utilizing caffeine, which can increase your blood pressure and pulse rate, or other measures to stay awake, other medications to stay awake, that can increase your blood pressure, which then becomes a vicious cycle.
Yeah, and that can be really difficult to get out of. So treatment options with headaches can be so varying, and we're talking about preventative versus acute attack treatments. What are some examples of acute attack treatment options?
Well, patients are familiar with over-the-counter medications. Aspirin, acetaminophen are probably the most common medications utilized for headache management for an acute attack. They can be overutilized, and that can be a problem. There are combination acute medications that have aspirin, acetaminophen, and often caffeine, and people are familiar with that medication called Excedrin or Excedrin-like drugs. They need to be regulated. You need to, keep the attack medicines down to no more than 2 or 3 times a week. If you're taking them more often than that, you really need to be on a preventative, no different than a patient with asthma overutilizing their inhaler and not treating the underlying disorder of asthma. So you might be on your controlling drug to improve your headache threshold, decrease your triggerability, and then you'd have your attack medicine should an attack break through.
I actually read in a lot of the studies that have gotten me to where I am in biofeedback, behaviorally, if an individual goes into a room and they turn off the lights and they put the covers over their head, then that behaviorally becomes a dominant way to actually cope with the headache. So in other words, nothing that they could actually do outside of going and laying down and covering their head with a blanket would be as effective. And so this is going to be, you'd have to actually start making choices to get out and doing more things, and making choices to try other options to effectively treat the headache. Do you see a big behavioral component like that?
We do. Behavioral disorders are common in chronic headaches. Depression, anxiety are common, what we call comorbidities. That doesn't mean you have headache disorder because you're depressed or you have headache disorder because you're anxious, but they often go hand in hand. They're all neurotransmitter disorders in the brain, and they need to be treated. So if a patient has depression or anxiety, those should be treated properly to improve the patient's headache threshold. But the question of whether or not a patient is going to go into a quiet, dark room, it depends on the severity of that headache attack and the components of that headache attack. That often is therapeutic on many levels. The light can be provoking worsening headache pain. The sound can be provoking worsening headache pain. But being in a quiet, dark, cool place can also lead to relaxation and stress reduction. And sometimes patients say sleep alone is their best treatment. If they get a good night's sleep, they often awaken without a headache the next day, no matter what they've taken during the day.
Yeah, and making sure your circadian rhythm is on track, and that you essentially have good, healthy sleep patterns. There is a concept in psychology called learned helplessness, and that is where you experience a symptom over and over again, and you can't find relief from it. Within all of a sudden, you just give up looking for options, and you essentially will start to delve into depression. And we see a lot of that with individuals. We're visiting with Stephen Herzog. He's the medical director of the Headache Institute at Texas Neurology. We're opening up the phone lines at 214-787-1190. We'll be right back after these commercial breaks.
From the Talk Radio 1190 Weather Center, this update is brought to you by Wix. Sunny today with a high in the upper 70s, clear tonight with the low around 56.
If only everything in business was as easy as creating your own free professional website with Wix.com. No tech skills are needed, and you can choose from hundreds of beautifully designed templates. It's easy. Get your business online today for free at Wix.com. That's Wix.com.
With so many people thinking about the future in the beginning of a new year, I can't not take a moment to tell you about a great place like this that helps you forge a new path that has a brighter career future ahead of it. It's nothing magical. It's nothing difficult to believe. It's a campus. It's a training center right here in the Irving area, and it specializes in redirecting people's career path. We're talking about the IT industry. Maybe you've heard about My Computer Career and thought about getting into IT. Maybe you've thought about a career in computers. Maybe you've spent 5 minutes on your smartphone to take their 5-minute career evaluation at mycomputercareer.edu, but you haven't visited the school or seen the classrooms. Maybe you haven't met the IT pros who can help change your life. At their campus, in a matter of months, you learn the skills you need to get an IT job. But to get the job, you got to get the skills, you've got to get the certifications the employers are looking for. There's financial aid available for those who qualify, including the GI Bill. How about a career change? It could start with a free career evaluation. 5 minutes of your time at mycomputercareer.edu. A new year can mean a new career. mycomputercareer.edu.
And now, a touching moment while staying in touch with Geico.
Just the other night, as I gazed up into the sky, I saw a shooting star. In that moment, I made a wish that Geico would be available 24/7. By phone, on the web, or with the Geico app. After that, I realized my wish had already come true. So basically, I had just wasted a perfectly good wish. Then I started to think about dolphins and felt better right away.
Geico. Anywhere, anytime.
Texas. It's a big state with a whole lot of wind blowing around. What can we do with all that wind? Or what do you say we power all of our homes with pure 100% wind energy? At Breeze Energy, we're totally 100% green. We don't do coal or nuclear, and we never will. So why not go with the wind? Go to breezeenergy.com. We think you'll see we're a genuine breath of fresh air.
This is an announcement for all people who want to take a risk-free challenge to whiten their teeth in 5 minutes using clinically proven power swabs. This risk-free challenge is for people whose smile has been yellowed by coffee, tea, or smoking. It's so effective, we challenge you to try it for 5 minutes to see how white your smile could be. If lines are busy, try again. Dial 1-800-663-5922. That's 1-800-663-5922. 1-800-663-5922.
I am
want to thank my mommy for loving me so much, for taking me out to the park, for reading me books, for taking me to the doctor when I broke my foot in ballet rehearsal,
For leaving me alone when I wanted to be alone.
And now, as a grown-up, I'm thankful for being able to take care of you, my dear mom, for having the chance to take you to the park, for reading you those books we enjoy so much, for being able to take you to your therapies after you twisted your ankle, for understanding that sometimes you simply want to be alone.
Roles change without us noticing. And in your new role, we help you help. Visit aarp.org/caregiving to get practical health and wellness tips to provide even better care for your loved one. Remember, visit aarp.org/caregiving. AARP. We help you help. A public service announcement brought to you by AARP and the Ad Council.
You're listening to the Therapy Hour with Rusty Lozano, brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas.
Welcome back. If you are just joining us, we are visiting with Stephen Herzog. He's the medical director of the Headache Institute at Texas Neurology and clinical professor in neurology at Baylor, Texas A&M. This segment is Let's Talk to the Doc. We're opening up the phone lines at 214-787-1190 or 817-787-1190. And while we wait for those callers, Dr. Herzog, let's talk a little bit about how you got into medicine. What was your interest?
Well, I think that I was very intrigued when I was young with my pediatrician and his command of what I was, of science and how respectful my family was toward him as a physician. And so my interest started there and then just developed through high school and into college.
Did you grow up around here?
No, I grew up in Arizona.
In Arizona. And did you go to school in Arizona as well?
I did. I went to University of Arizona medical school.
And how long were you there? And how did you find Texas?
Well, I came to Texas to train at Parkland at Southwestern. I did my neurology training here in Dallas and ended up staying.
That's a huge facility.
It's
Parkland
beautiful.
Is. Yeah, it's really nice. Let's take a caller. Hi, welcome to the Therapy Hour.
Yeah, I was calling a question in regards to migraines and headaches. I guess a lot of people just immediately, as soon as they get a migraine or headache, they run to the medicine cabinet and get medication rather than see if the pain is just going to dissipate. What is your recommendation on that?
Well, it depends on the patient's pattern of headache. If they're able to get the headache under control with hydration or often Gatorade and going and resting and relaxing for 15 to 30 minutes, we're always in favor of treating naturally. Often patients with migraine can tell when they cross a certain line that they're going to need medication.
Okay, thank you very much.
Sure.
Interesting. So with meds over the counter, we talked about the acute attack, preventative medications. I mean, you don't want to necessarily always rely on that, but there are other options for sure.
There are other options, but if a patient has frequent headaches and they're taking, especially over-the-counter medication, but even a prescription pain medication, they need to monitor the frequency, and that's where the headache calendar comes in. If you're taking a medication more than twice a week for a headache, either over-the-counter or by prescription pain medication, you need to discuss with your physician whether a preventative medication is appropriate.
How does a headache calendar work?
Headache calendar can be as simple as a calendar from the drugstore all the way up to an app on your iPhone. There are lots of applications for headache calendars.
Yeah, that's really cool. That's very convenient. Maybe we can talk about some of those apps here in a minute. Let's take another caller. Hi, welcome to the Therapy Hour.
Hi, I had severe stomach pain and have gone to multiple doctors, and they can't seem to figure out what it is. So my stepmom mentioned that it might have to do with migraines, but I've never heard of anything like that before, and was just wanting to hear your thoughts about that.
Well, actually, there is a condition called abdominal migraine. It's more common in children than in adults. It manifests itself as severe abdominal pain and GI symptoms, often with very mild headache. And the patients can go for weeks, months, or even years before a diagnosis is made. So often by the time I see a patient, they have had a full GI workup or their internal medicine doctor or their family doctor has evaluated them for any other secondary causes of their symptoms. And we often come to the conclusion that it is an abdominal migraine. A little different in adults, though. The abdominal symptoms can be severe, but they're often accompanied by at least a mild headache.
Okay.
Do you get mild headaches?
No, not usually, actually.
When did this start?
About 3 years ago.
Well, if your evaluation and management has not found an underlying cause, it would be a consideration to seek the attention of a neurologist and see if it falls into the category of abdominal migraine or migraine with excessive abdominal symptomatology.
Okay, great. Thank you for your advice.
Sure.
Thanks for calling. You know, abdominal migraines, and that's an interesting subject altogether. Is it a different beast than the migraine itself?
It probably is. On the spectrum migraine, it's definitely a different beast in children because the abdominal symptoms are often very severe and very debilitating. Kids are often out of school and missing, playtime with their peers. And since headache is not a common feature of that disorder, it can take a long time to make the diagnosis.
Yeah, interesting. And it takes a lot of patience. I know I see kids that have abdominal migraines and they do miss a lot of school. And, one of the sad things that I see happening is that when they're gone for so long in the school environment, it now becomes almost psychologically a trigger for the headaches. I don't want to go back now. I have a mounting amount of work to do. And I'm sure it probably happens as adults as well because, we don't want to be around something that causes us stress and pain. And so now all of a sudden, like you found another environment, found another way to either have time to recuperate, but then like the thought of going back can actually be a trigger itself.
Absolutely. Anticipatory headache is a common feature of migraine. Especially when the migraines are debilitating. A patient might feel a little discomfort in their head, and the anticipation that this may become a full-blown migraine attack often provokes the migraine in and of itself.
That's fascinating. Dr. Herzog, when you are working with a patient, what's the typical way that you actually connect with them? I mean, as far as like the relationship wise, how often are you seeing patients?
Well, patients often, after their initial evaluation, come back in 2 to 4 weeks. We review any diagnostic testing that was appropriate, and we begin the education process. We go over everything we discussed at the first visit. Often it's overwhelming at an initial office visit with any physician. A lot of information is covered. Often handouts are given, and sometimes patients read them and sometimes they don't. We can often tell when a patient comes back based on their questions they have at the second visit whether or not they've read the material. Often there isn't enough time to read all the material, but we encourage them throughout the course of treatment to do reading on the subject.
And are there some books, or there some resources that you can actually recommend for patients?
There are 2 books that I often recommend. One is called Heal Your Headache by Dr. Buchholz. It's a very old book on headache, and Dr. Buchholz is very conservative, and he approaches it from a natural perspective in terms of limiting medication. The other book, I think, on the other end of the spectrum is called The Migraine Brain by Carolyn Bernstein. And it's an excellent book on migraine, and I recommend it to all my patients.
What was that? What was the author's name again? Carolyn
Bernstein.
Bernstein. I'm writing this down. Do you and as far as like how can people find you? How can they get in touch with you?
Well, they can go to our website, texasneurology.com, or they can call the office at Texas Neurology, and the Headache Institute is within Texas Neurology, and the phone number is 214-827-3610.
And you serve individuals in the Dallas Metroplex. And
actually, I have patients from all over Texas and Oklahoma and Louisiana, and some patients have come in for an opinion after they've seen other neurologists just to see if there's a different approach.
That's phenomenal. It's actually, and you actually have quite a big staff. You have 100 staff in your office.
The entire Texas Neurology staff approaches 100. We have 9 neurologists. We have a number of advanced practice providers, nurse practitioners, physician's assistants, nurses and medical assistants, and of course our fantastic business team who keeps us running.
That's phenomenal. That's a lot of staff too. I mean, we were talking about, how do you keep up with everybody, and it seems like it's just.
Yeah, thank God for name tags. We all are required to wear name tags, even the doctors.
Yeah, that's awesome. That's really great. So, Dr. Herzog, couple more questions I have for you about the onset of headaches. When you're dealing with this, you shouldn't feel afraid. You shouldn't be afraid to go and seek help. What are some words of encouragement that you could tell individuals who are trying to find these over-the-counter treatments and maybe natural effects without having to go to the doctor? What could you say to those individuals to make them consider, seeking out a specialization?
Well, I think it's very important that you talk to your physician, general physician, your internist, your family physician, pediatrician, gynecologist about your medical history. And if headaches are a component of your medical history, they should know about it. If headaches are increasing in frequency, if they're changing in severity, if there are unusual characteristics, then you ought to think about seeking the attention of a specialist in headache management. Neurologists are all headache experts. And then there are those of us who are subspecialized in headache management, like myself, who only deal with headache disorders. So I think the most important thing is that there is help, and there are ways of approaching headache. It isn't all about medication, and we can make a big impact if we work together.
That's very encouraging. Last words here. Dr. Stephen Herzog, thank you so much for being on the show. Dr. Stephen Herzog, Medical Director, the Headache Institute at Texas Neurology, Clinical Professor of Neurology at Baylor, Texas A&M College of Medicine, Board Certified in Neurology Headache Management. Thank you for joining us. You guys have a great day.
Thank you. My pleasure. Thank you. My pleasure. Thank you. My pleasure.